Our format for this evening, what we're going to do is we're going to hear the presentations from our doctors first. Then afterwards, we're also going to hear from special guests. We have 4 folks. 2 were living kidney recipients, and 2 are living kidney donors. And they're going to share their journey with chronic kidney disease. And now I'd like to introduce 2 of our speakers this evening. The first is Dr. Ramona Wong, if I could have you stand. Let's give her a warm welcome. Although she doesn't look it, she is a retired nephrologist, and she received her MD at the John A. Burns School of Medicine. She did her internal medicine residency at UH, and then at the University of Colorado, she did her fellowship in nephrology, which is specializing in kidneys. Interesting factoid, she did general practice for 8 years in Honoka'a. And where did she do it? She did it on the Hamakua sugar plantation until it closed. She also started Aloha Kidney. You might have seen the information table outside, which is like an organization that helps educate the public on chronic kidney disease. And she does it on her own, no funding involved. She is so passionate about teaching people what they can do to prevent chronic kidney disease, or if they have it, how they can alleviate some of the issues about it, that she puts her time into that. So that is Dr. Ramona Wong. I'd also like to introduce to you at this time Dr. Makoto Ogihara. He is a liver, kidney, and living kidney donor transplant surgeon, and he is the primary living kidney donor surgeon here at the Queen's Transplant Center. He received his MD at the University of Tokyo School of Medicine. He did his residency in general surgery at the University of Hawaii. He did his transplant surgery fellowship at Stanford University Medical Center, and he is board certified by the American Board of Surgery. He began his career in transplantation in 2005. He is the director of the Living Donor Program at the Queen's Transplant Center. And he enjoys spending time with family and playing golf, guitar, drums, doing skiing, and scuba diving. Oh, I feel out of shape now. Okay, that is Dr. Makoto Ogihara. And we're going to start off with Dr. Wong.
Good evening. Aloha. My talk is about chronic kidney disease and whether you're at risk. And if you are, maybe you want to learn about what you can do, or learn about how it goes, and then you can decide what you want to do. So, what is chronic kidney disease? It is a permanent scarring, damage to your kidneys. Most people have 2 kidneys. If you have chronic kidney disease, whatever is scarring it is damaging both of them. And otherwise, you wouldn't necessarily notice in your blood tests. It usually gets worse over time. And we currently we sort of stratify those with chronic kidney disease based on what's causing it. So that's an important thing that you and your doctors need to work on, figuring out what's the cause of my lower kidney function. The second is how much function is remaining. And the third is how much protein am I spilling in my urine. That is how we kind of classify kidney disease now. And that's been ever since 2000, not that long ago, actually, about 2013. What are the risk factors for chronic kidney disease? Diabetes is the #1 cause. In the nation, about 45% of those that have kidney failure are attributed to diabetes. In Hawaii, it's more than that. 63% of our kidney failure patients are from diabetes. And it's largely type 2 diabetes, which is a result of maybe some genetic tendency. But in addition to that, it's not just a sentence. Just because you have diabetes in your family, you're not going to get it necessarily. It has to do with your choices that you're making every day and your lifestyles. So we'll talk about that a little bit later as well. So diabetes, pre-diabetics, and even being heavier tends to be a risk factor for chronic kidney disease. High blood pressure is the second most common risk factor. So the two of them account for the majority of our people that have kidney failure. If you have a family history of chronic kidney disease, there's some inherited diseases, but there's also sometimes genetics and lifestyles that you tend to adopt because you're in the same family. So those things tend to, if you have family history of kidney disease, you may be at risk. Anybody with poor circulation to the heart, the brain, the limbs, or their kidneys, so if you have had a heart attack or a stent to your heart, or a stroke or a temporary stroke, or circulation problems to your legs, you're also at risk for kidney disease. Those with prior kidney damage or injury, maybe they had a bad flu or a bad infection, ended up in the ICU and hurt their kidneys, they may have recovered, but they're at higher risk for developing chronic kidney disease later as well. People with multiple kidney stones, inflammation of different parts of the kidney, exposure to toxins, which could be medications, can damage the kidney. And there's a host of other causes. There's many other causes as well. But these are some of the main ones. The problem with kidney disease is that it's very silent. It's quiet. You won't notice anything, you won't feel anything, and you may be developing it. So it's important to understand the risk factors, and if you have risk factors, there's something that you can do to screen for it, to find out if you're developing it, because if without the screening test, you wouldn't know. You feel perfectly normal. One of the only signs, and signs are things that we can see, you won't feel anything, but one of the signs that you might have early in kidney disease is this. So if you look in the toilet after you pee and you see lots of bubbles, this kind of frothy bubbles, this may be your only sign of kidney damage for years. A lot of diabetics have this kind of frothy urine for a decade before they start losing kidney function. And the earlier you find out that you have kidney disease, the more you have to protect, the more that's still working, and the more that there's a lot of things that you can do to protect what's left. So how many of you knew this already, except for the healthcare professionals? How many of you knew about the froth in the urine? Okay, not a lot of hands going up. So I want everybody to talk about it, because this is a really easy thing to do. You know, look in the toilet after you pee, especially if you have family with kidney disease or diabetes, high blood pressure, any of the risk factors. And I say this in my classes. I tell men, you know, men, sometimes you have this urinal, right? And you guys all, I mean, women, we always have our own stall. We never see anybody else. But sometimes in these public areas, men go in the urinal, you know, peeing at the same time. If you see bubbles coming out from the guy at the end, go tell them, you know, they should go get screened. So, you know, help them out. But anyway, it could be an early sign, right? So why does early detection matter? It may not matter to you. It depends on you. It depends on whether you want to do something about it or not. Just like, you know, in medicine, we have a gazillion tests we can order on you. But if you're not going to do anything because the test is abnormal, then I shouldn't even do the test, right? And just like my dad, he's really hard of hearing, and we could get him a hearing aid, but he said, I'm not going to wear it, so I'm not going to go get the hearing aid. So it's up to you. If it matters to you to protect what's left, then recognize you're making choices every single day that will nudge you towards or away from chronic disease. And it may not be kidney disease, it could be chronic heart disease, chronic, other chronic diseases, but you're making your choices every single day. So I think the most important thing to me is to understand that you are making choices, and then you have the freedom to choose. And even once you understand what's more helpful, you may decide today, I don't want to do that. I want to pig out at the baby luau because it's a baby luau, and I'm going to eat the Kahlua pig and the lomi salmon and the pipi kaula because I want to enjoy myself. Well, there's value in immediate joy. So I'm not criticizing that at all. I do it all the time. Whenever I know what's helpful, we know everything that's helpful, but we don't do helpful things every single day, all day long. You have to decide that. Is it worth it? It's not worth it. And sometimes, maybe not every day you want to enjoy so much if you want to buy some time in this body. So, to me, this is sort of how life goes. I think we all kind of come from an energy source, and we can debate about that, but we're born. Then we have this existence time, we have bodily life, and then we have that last transition out of bodily life through death, and we go back to source. And then, so I think, there's definitely a bodily lifetime, and it's finite. This body doesn't last forever. So you are the co-creator of your bodily life, whether you realize it or not. Your genes, your genetic tendency is not usually a sentence. It's a beginning. And then what you do with it on your daily choices is how then you evolve, especially with regard to chronic disease. So understanding your daily choices, I think, is very useful. And just understanding how it goes. I'm not here to tell you what to do or what not to do, but I'll tell you what our country tends to do. So in these national health and nutrition surveys, they have these NHANES surveys. They did this survey back in over 5 years, and they published it. So in 1995, they asked people, how many of these things that we know leads to best cardiovascular health? How many of these things do you achieve? And so they polled America for 5 years, and they published in 1995. So keep your blood pressure normal, blood sugar normal, don't have diabetes, have normal blood sugar without medication, cholesterol or blood fats normal weight to height ratio, not too heavy for the height that you are, exercise regularly, eat more plants, eat less salty sugar, saturated fat, and don't smoke. Anybody have any problems with these being things that we should do to maintain good heart and cardiovascular health? Anybody arguing with these? We've known these for decades, right? Okay, so in 1995, what percentage do you think said yes to all 7? 15%? Anybody else? Everybody good with 15%? Just throw a number out. 10? 3? Whew, the pessimist. Okay. 2%. 2%. Okay, they did the same exact poll in 2011. 15 years later, right? Fast forward 15 years. Okay, what percentage now? Same questions. What percentage? 25. 40? 5. What was 60? What do you think? 5. Oh, okay, so the pessimist went to 5. 1.2%. Okay, we're going down, right? We know these things, so knowing is not enough. Knowing is not enough. We all know these things. So if you want to be by default, just figure, okay, I'm an American, we're going to be okay, I'm okay. It's not true, because America doesn't prioritize your health. You have to prioritize your health to sort of fight the culture. And I can go on forever about what I think the culture is based on, but it's not about your health. If it were, we would do much better on these polls. So that is not the default. You're the one that has to manage your own health. What about how is our health as a nation? The CDC came out and reported in 2015, 1 out of 2 adults, American adults, has chronic disease, and 1 out of 4 Americans live with more than, or at least 2 or more chronic diseases. So that's a pretty sad thing to hear. 7 out of the top 10 causes of death are from chronic disease, and these chronic diseases are largely a result of our daily choices. This is a slide that changed my life, and this is really why I really felt the need to go into educating patients. This was published in 2003, right after the equation GFR came out, and it for the first time showed us the numbers of Americans in each of the stages of kidney disease. So based on your level of kidney function, I don't have my cursor, oh, here we go. So these is greater than 90% kidney function, all the way down to less than 15% kidney function. You can see there's about 5.8 million Americans in stage 1, greater than 90% kidney function, 5.4 million in stage 2, 7.6 million in stage 3, and 440,000 in stage 4, 430,000 in stage 5. Now I know, Makoto knows, we don't keep everybody until they live to a ripe old age in stage 3. The large majority of these people die before they even get to stage 4. So when people come to see me, when they're seeing me in practice, I love practicing nephrology, but they were seeing me usually around here. If I was lucky, I was seeing them here, here, and here. But everybody here needs to understand how this goes, because the minority are going to end up going on to kidney failure and have kidney failure as their life-limiting organ. The more common cause of death will be cardiovascular, so heart, sudden death, heart attack, stroke, or problems with circulation to their limbs. So it's not just the kidney we have to protect, it's your cardiovascular system, it's your whole self, it's the entire you. And so when I saw this, I was shocked. I thought, I didn't think it went like this. And so I felt that people need to understand how this goes, so that if you have chronic kidney disease, you understand what choices you have and you make them sooner than later if you want to make a difference. I mean, if I knew I was going to die next week, if I knew, right, I would live my life very differently. If I knew I wasn't going to live till 90, I might live my life a little differently. And every moment becomes more precious. So I always say, if I was going to die next week, I wouldn't be here talking to you. Right? So I want to know. And I used to hedge about showing the slide, but I feel like, why? I mean, why sugarcoat it? I think you need to know how it goes so that you have the opportunity to make the choices that you want to reach your goals in life. So I thought, okay, everybody with CKD needs to understand how this goes, and not to make them scared, but make them appreciate what they have. And then all those who even don't have kidney disease, diabetics, hypertensives with heart disease, they should understand how it goes if they get kidney disease. So maybe they'll make some choices upstream and not even go there. Those with obesity haven't even gotten pre-diabetes, but have a family history of it, they can make that. So I always keep walking back, juvenile obesity, we should be in the schools. And then I thought, okay, I really want to be in prenatal classes. I want to be in prenatal classes so that when you're pregnant and you're worried about the life of that baby, you recognize as a parent, you can nudge that baby once it's born towards chronic disease, or you can nudge them towards health. You can teach that baby what you do by what you do, not tell them and then do what I say, don't do as I do. But you can lead them by your behaviors to choose everyday activity, everyday eating, everyday nurturing, everyday peace instead of stress. So taking care of your body, and then every once in a while have the treat. So put the treat category and the everyday category so that you can help that child understand how to live the most and get the most out of life. So I want to ask you what your life plan is. What is important to you? And I think looking at life as a finite entity is how we're going to get the most out of this life. I think embracing your end is critically important to understanding how you enjoy today. Until you do, you're always not addressing it and you're always in fear of it. So embracing your end, figuring out, okay, what is important to me? Who do I want to spend time with? What do I want to spend my time doing? That's the assignment my kidney class attendees have for their first week. Figure out what's important to them. Figure out what they want to experience. And then also about how much time is enough. I would love to get to the end of life. When I get to my end of life, I hope I feel like I've done what I need to do. Because otherwise, I feel gypped. And then I'm grasping for straws and I'm wanting to hold on. And the last, when you're trying to do that and you cannot, that's hard. It's a rough time. It's not a great quality at that time. So I want to be at that point where, and I hope I'm there today, if I go today, I'm grateful for what I have had. And I've done exactly what I want to do. So I want you to also think about what you would want to do in a health transition. So we're all going to get to that transition at the end of life. So thinking about that and orchestrating it, or asking at least, telling the people that you love you're going to be leaving behind, telling them what you would want at that time, because you may not be able to speak to them at that time, helping them understand what you want, what you don't want. And I've had that discussion with my son already. He doesn't agree with me, but at least he knows what I want and what I don't want. So he doesn't have to worry about should she, shouldn't he, would she? So I think those things are important. And then for kidney patients, if your kidney goes down first, you have other transitions before that last transition. Do I want dialysis? Do I want transplantation? Or do I want, so there's a lot of transitions ahead. So understanding those things I think are helpful for all of us to get the most out of our life. Now, most of us would love to go through life like this. At the age of 104, this man is completing a race. But many of us don't quite get there due to heart attack, stroke, gangrene, dialysis. Hawaii has one of the higher rates of kidney failure in the nation. We're in one of the highest 20% in the nation. And so I think you need to understand a little bit about what the kidneys do and how they work so you can understand how to take care of yourself, protect what you have. So most people have two kidneys. They're about the size of your fist. And the heart has to pump a lot of blood through that main artery to the kidneys for them to do their job. So every heartbeat, 1/5 of the amount of blood that's pumped forward goes directly to the kidney for filtering. And the kidneys aren't that big, right? So they get a disproportionate amount of blood coming to them. So when the artery, thank you photo search for this, I took it off the web, but it's a very nice diagram. So the artery branches once it gets into the kidney like a tree. And it's in the tiniest branches, this is sort of like an artistic diagram, it's in the tiniest branches that the filtering occurs on the surface of the kidney, and there's millions of these tiniest branches, which are the filters of your kidney. So that's where filtering occurs. Now when I take one little branch, the tiniest branch, and blow it up for you, it looks like this. So this is the last, second to the last branch as it enters, and then it bursts into these teeny tiny filters, they're arteries, that act as filters. And it's here that the filtering occurs, and so dirty blood comes in, filters here, whatever comes out of the blood gets caught by this tube system, gets modified and comes out as urine. And then after the filtering occurs, the clean blood goes back to the body. So this is the smallest blood vessels in your kidneys, and that's where the filtering occurs. So again, you see the blood going in there, it's like a little cartoon, and if I slice it in half, that's what it looks like cross-section. The wastes are going to come across those walls now. They're going to exit the blood and end up as urine. So the glomerulus is the name for that filter. There's millions of them on the surface of your kidney. The glomerulus, the way it works is the dirty blood flows in, the wastes come across those very special walls. That's the only place in your body that the wastes come out of your bloodstream to then exit your body, and then clean blood flows back to the heart. So those walls of those glomeruli, those little filters, are like a fine mesh net. So small things supposed to come through, right? So the cellular waste, the excess salt and water and calcium, phosphorus, those kinds of things are supposed to come out of your bloodstream because you don't want it in your body, and it's supposed to come out in your pee. But the big things like protein and red blood cells, not supposed to come out of your bloodstream and into your pee. They're supposed to stay in the bloodstream. But if you have pukas in your net, so you got damage to the walls of your blood vessels that are acting as the filters, then protein can then sneak out of your bloodstream and end up in your urine and show plenty bubbles like I showed you earlier, right? That can be a sign of kidney damage. And they're damaging those tiny filtered blood vessels. So creatinine is the blood test that we measure. We measure it in your blood. It's a waste product made by muscle cells. It's dumped into the bloodstream and supposed to be filtered out by your kidneys. I measure creatinine to see how clean your blood is. If it's low, like that trash can, the trash service must be working, so the kidneys must be working. If it's full all the time or it's higher than usual, then kidneys must not be working, the trash man not coming to work. So unfortunately, creatinine depends on your muscle mass. So there's an equation now called GFR that accounts for those people that have less muscle mass. So those would be the older people, seniors, and women tend to have less muscle mass. So there's an equation now that we use, and it's called GFR, stands for glomerular. That's where that G came from the glomeruli, filtration rate. So it's telling us what percentage of your kidney is still working, how much is still working. And it will kind of give us a percentage of your kidney function. The other test that we rely on is going to tell us the health of those remaining working glomeruli. So the ones that are still working, how healthy are those? Well, that depends on how their walls are, right? So if I see a lot of protein or albumin in your urine, that means that the remaining filters are all damaged. If I see plenty protein in your urine, it's really damaged. So that now, these two tests are what we use to stratify your risk if you've got kidney disease. So first we use GFR, You find the percentage of kidney function you have remaining that's working, and then you find how much protein you're spilling in your urine, the urine albumin. So there's 2 tests, one blood test, one urine test. And it will put you on this heat map. The hotter the color, the sooner you're going to get to a health transition. The cooler the color, the slower you're going to get there. We're all going to get to that last transition in life, but this gives us an idea as to not just your risk for kidney failure, but also heart attack, stroke, or death. So we're all on this grid somewhere. And so it's a little bit of a crystal ball based on 2 simple tests. And you can ask your doctor about this. If you have risk factors for kidney disease, I'd be asking my doctor on a regular basis, every year at least, to screen me to see where I am on that grid. So I would know. I want to know. Not everybody wants to know. So the question is, do you want to pee? And pee is something that stands for not just urine, but if you understand, once you understand how it goes, then prevention is possible, protection is possible, and planning and preparation is also possible. And if you can do these things, it may smooth the transition ahead. It may take some of those bumps out of the road. You don't have to if you don't want to, but if you want to, it's available. So understanding is important. CKD prevention, few tips are keep hydrated, don't get dehydrated. Daily choices, there's a lot of them that we go over in classes as to what you're deciding every day. Knowing your risk factors and try to avoid getting those risk factors if you can. If you already are at risk for kidney disease, control those risk factors. That can buy you more time. If you're at risk, ask your doctor to check the screening test, GFR and urine albumin once a year. And if you end up being positive, they'll confirm it. If you are positive, there's a way that you might early on, you might even be able to really keep it there, control it there, so it's very slow to progress. So Aloha Kidney classes can help, and there's some brochures in the lobby if you're interested in learning how it goes. Again, I don't tell you what you should do. That's for everybody to decide themselves. We're all different flavors. But if you want to know how, you can also learn how to protect what's left. Again, diet, hydration, exercise has been shown to help kidney patients live longer, last longer, delay kidney failure even. Stop smoking illegal drugs. There's kidney protective medicines, meds that have been proven to make your kidneys last longer, especially if you have protein in your urine. So ACE inhibitors, ARBs, we go over lists of those in class as well. And then monitoring your blood pressure at home, because there's a range within which it's best for your kidney. There's something that's too low, and there's something that's too high. And if you're on high blood pressure, lowering medicines, I've seen too often people come into the hospital and now need dialysis because they've been taking their high blood pressure medicine every single day, and yet their blood pressure has been too low because they're dehydrated, they've been vomiting, they've been having diarrhea, and yet they take their diuretic and their blood pressure lowering medicines every single day, and when they come in, their blood pressure is 80 over 50, and now I need to dialyze them. And so, they were hurting themselves without actually really understanding how to take their medicines. Controlling blood sugar is important, avoiding kidney toxins. Some things over the counter are kidney toxic. There's some herbal things that are kidney toxic and cause kidney failure. So again, I think the more you understand, the more you can protect. And then, should you end up looking at kidney failure or looking towards kidney failure, there are options. So what's the intersection look like? You want to know what the intersection is before you get there. If you don't, well, we'll do the best we can, but if you know ahead of time, you have a better chance of choosing what it is that you want that's aligned with your goals. So there is dialysis. There's different kinds, home dialysis, in the dialysis center kind of dialysis. There's ways that you can dialyze without using needles. There are ways that you can dialyze with needles. Transplantation is another life-prolonging beyond kidney failure option, and transplantation we're going to hear a lot about in the next hour. But there are ways that you can plan for this ahead of time. You can get your name on the list ahead of time before you end up needing dialysis, and that can accumulate time credit for you. Then putting the word out, somebody may come forward to offer you their kidney. So dialysis, transplant, and the natural end of life. We can also support that. If that is your preference, we can support that. And we can try to help you make a more comfortable transition. So it's a choice. whatever it is, there's no right or wrong answer. It's what do you want? So I think understanding these things help you be able to make an informed choice every day, as well as at those, for those times ahead. So just in summary, I think recognizing that you're the co-creator of your life and you're the most important voice for your daily choices. If you don't understand the choices that you're making, then you're making them anyway. And if I was trying to help improve kidney outcomes, I realized we're not going to improve the outcomes unless you understand how to. But you can learn to prevent, protect, and proactively manage kidney disease if you care about yourself. So this is a different CKD mnemonic. I think C can stand for care about your bodily health enough to, K for know or learn. Come learn with us. We have a lot of people coming to classes trying to just to understand the impact of your daily choices. And a lot of these people don't have kidney disease. They're coming to support somebody else or just because they're interested or curious. Because once you understand, then you can make your choice to do what it is that's aligned with getting the most out of your life. And hopefully understanding all the transitions ahead will make them easier and smoother transitions for you. So if you want to learn more, we have these classes. I teach the classes. I have awesome volunteers who come forward to share their stories, to help out. There's some very dedicated staff who's taken care of kidney patients for a long time. There are volunteers who have gone through kidney failure, dialysis, transplantation, who share their stories. It's statewide, so except for Kaho'olawe and Niihau, we have it. So on Oahu, we have it Queens, both Punchbowl and West, as well as Polymome and Castle throughout the year. It's no cost to you. They're free, and we have a website, and there's brochures in the lobby if you're interested. So thank you so much for spending your time with us.
So prevention is the best treatment, but unfortunately, if you need to be on dialysis, then I'm going to talk about kidney transplant is generally speaking, better option than dialysis. You already, Dr. Omono showed a picture. So the kidney, typically there's a right kidney and left kidney, and those are connected to the bladder. That's where urine is stored. When we place a new kidney, the transplant kidney typically goes into the right, sometimes to the left side of the lower body. It is connected to be the artery and vein of your own system, and also what is called ureter, that is a shishi pipe that transfers the produced urine to the bladder. That'll be also attached to your own bladder. So typically, transplant surgery takes about 2 hours, and we put this new kidney in your body and connect all those 3 important structures. That's the kidney transplant. Don't ask me the names of these celebrities. I don't even know what who Donald Trump is, but these are I just borrowed all these pictures from internet. So some athletes and singers and comedians, actors, actresses. So compared to being on dialysis, the benefits of a kidney transplant, typically you feel better, and also you don't have to be on very, very strict dietary or fluid restrictions, so you can enjoy papayas and nattos and some good food, orange juice and bananas which has high potassium, which is typically healthy food. Many people can go back to work after receiving kidney transplants, and you have a more independent lifestyle. And also, you tend to live longer with a kidney transplant compared to being on dialysis. This is kind of an old slide, but you can tell the life expectancy on both on kidney transplants and also on dialysis are improving each year. This is kind of an old slide, but if you just compare being on the dialysis, this is the actual survival on the kidney transplant. So if you receive kidney transplant, you tend to live longer and also have a better life. First kidney transplant, successful kidney transplant was done in 1954 in the mainland. The first kidney transplants in Hawaii was done by Dr. Livingstone Wong in 1969, and since then, local Hawaii team, we have done more than 1,000 kidney transplants in Hawaii. And since we moved the program after a former location hospital went into bankrupt and we had to move the program, since we moved to Queens Medical Center in current location, we have just finished, I believe, 200 kidney transplants. I checked the UNOS website, and by the end of May, we had done 157, and I believe we did 3 in June. So if I'm wrong, our coordinator and manager, Jennifer and Miley, may scold me, but I think we've done 200 kidney transplants, including both from deceased donors and also living donors. So we have a medium-sized program here. The challenges of kidney transplants, again, transplant, generally speaking, better than dialysis, but why then many patients still remain on dialysis instead of getting a kidney transplant? One big reason is that this gap, many patients are waiting on the waiting list, but actual kidney transplants happens much less. So available organs are fewer than the waiting numbers of waiting patients. And this gap actually widens every single year. So many patients are putting on the waiting list, but we don't have many organs available. The waiting time depends on your blood type and also tissue type. The blood type, there are A, O, B, and AB. The tissue type, we typically check 6 foci of HLA. Some people may know HLA D and B and DR and A and B. And also how many years on dialysis, that'll have some impact on the waiting times too. And also how many donors actually we have in Hawaii every year, or how many transplants typically happen in this area. You know, all those numbers will affect how many years you have to be waiting on the waiting list before you get a deceased kidney transplant. Typically, average waiting time is 3 to 5 years currently. Transplant happens both from deceased donor, so somebody who have passed away, wish to donate organs. So those organs come from either brain dead or cardiac death patients. Majority come from brain dead donors. 2014, we had 46 donors, and the trend is upward, and the numbers of donors in Hawaii per population is more than national average. So compared to mainland centers, we have actually more access to numbers of organs in Hawaii. And this is how kidney transplant has been, the numbers of kidney transplant has been trending over the last about 10 years. 2014, we had 50 kidney transplants at Queens Medical Center. This is 50 transplants actually from the deceased donors, and we had 10 living donor kidney transplants. I think the trend, since we moved the program 2012, I think we have increased the number of kidney transplants every year. But how many living donor kidney transplants have been done in Hawaii? It's actually not really upward trend despite all this education and encouragement. And actually in the mainland too, the number of living donor kidney transplants are not really increasing every year. So again, generally speaking, transplant's better than dialysis, but so the transplant, there are 2 types of kidney coming from living donors. It can come from deceased donor. Why living donor? Why you consider taking a healthy person's kidney out of their body and recycle to somebody who needs kidney transplant. Again, average waiting time on kidney transplant list in Hawaii, 3 to 5 years. If you have somebody in your family members or friends or anybody willing to donate, then if it's a good match, you don't have to wait those 3-5 years on the waiting list. We can schedule kidney transplants relatively quickly, typically in a several month time range. And also, transplant kidney from living person tends to last even longer than the kidney from stranger. So this is the half-lives of the kidney transplant. Half-life means 50% of the kidney have lasted longer than this year. So let's say the best graph here, this is from, okay, so this is from the living donor. This is from the deceased donor. So the half-life as of 2009, this again continues to improve every year, but it's hard to predict how many years the kidney that we just put in this year to last. It's a future. So the data is kind of old, but as of 2009, it was expected that half-life of the living donor transplant was about 15 years. 15 years means 50% of the kidney transplant will last more than 15 years, and 50%, half of the kidney will not last 15 years. That's the meaning of the half-lives. Compared to the deceased kidney is about 12 years. So, no, I'm sorry, not 12 years. It's about 10 years. When we talk to transplant candidates, we typically tend to say that the kidney from the cadavers or deceased donors tends to last about 10 to 12 years, and living donor tends to last 15 to 20 years. That's what I usually tell the patient. So, who can donate? You have to be 18-year-old or older, so the minors cannot donate. That's to protect the immature decision maker. You have to be healthy, and you don't want to be under the pressure, and you have to understand the donation process. You don't have to be related, so you can be brothers, sisters, siblings can donate to siblings, of course, parents, children, grandchildren, grandpa, grandma, uncle, nieces, they can all donate. You don't have to be blood related, so you can donate to friends, you can donate to spouse, or even you can donate to somebody you don't have to direct. Again, this is the experience of our own team. Regarding the living kidney transplant, we have about 25 years of experience, and 270 donors have donated their kidney as a living donors in Hawaii. Since I came back from the mainland, we changed the surgical procedure to keyhole surgery from an open surgery. And since then, we have done about 80 donor surgeries over the last 9 years. So we do about 8 to 10 donors a year every year on average. I think I've shown this before. Typically, the extraction site for the kidney, like Dr. 101 said, the kidney is about the size of the fist, typically 10 by 6 centimeter. So to take out the kidney, you still have to make one main incision, and most centers, how do I go back? No? Okay. So most centers use this vertical incision below the umbilicus, or what is called the bikini line. In addition to main extraction site, typically you get 2 to 4 other keyhole incisions for laparoscopic port site. If your family member or your friends are interested, you call our transplant center, 691-8897. There's a questionnaire you have to fill out. Then Miley is going to schedule an appointment and ask some questions. We have to run some tests. And also you have to understand all the risks and alternatives. You get successful surgery. There's a recovery. There is a follow-up, at least about 2 years. We will follow your kidney function, how you're doing. Even if you want to donate, if you have already pre-diagnosed conditions such as diabetes or high BMI, if you're taking medications for mental illness or severe heart failure or lung failure, any other infections or cancers or active smoking, if anything, that will impact negatively on the kidney that you donate or your own health after donation, then we don't recommend living donation. I mentioned ABO. There are 4 blood groups, O, A, B, and AB. So the donor and the recipient doesn't have to have identical blood groups. Let's say if you know your blood type, if your blood type is A, then you could donate to somebody who has blood type A or AB. If your blood type is AB, then you have to donate somebody who has AB. If your blood type is O, which is called universal donor, you can donate to pretty much any blood groups. It's a little bit more technical, but let's say your spouse is interested, but okay, my blood group is A and my wife is B. I'm in kidney failure, and my wife wants to donate but cannot donate because blood type is not compatible, then we can help by working with other centers, going through paired exchange program, which means to find another pair, somebody else, to swap the kidney or do a multiple exchange kidney program. So even if you're not compatible, it's not the end of the world. If you're still interested in those programs, we can work still on the living donor kidney transplant. A little more detail. During the evaluation, we check your blood pressure, and also this is one of the cumbersome part of the procedure. The evaluation. You have to collect your urine 24 hours, and then we make sure your kidney function is normal. Blood test. We have to do some X-rays, and if you're females, we need some general cancer screening, and for 50 years or older, we strongly recommend colonoscopy. This is the picture. Boston, 1954, December 23, I think. The first successful kidney transplant took place between identical twins. That's why it worked. There was no good immunosuppression at that time, but because donor and recipient were identical twins, they didn't need any immunosuppression. That's why kidney lasted, recipient lasted 9 years after kidney transplant. So the surgery was done in 1954. Richard is the recipient, Ronald is the donor. I honestly don't know who is Ronald, which is Richard. I have a sense that this is actually the Richard and this is Ronald, but Richard passed away 9 years after kidney transplant. Kidney, I believe, lasted about 7 years. Ronald, he donated his kidney in 1954. He passed away in 2010. So he lived 56 years after donating his kidney. This is the longest survival after living donor kidney transplant from the donor side. he didn't have any kidney failure for 56 years. Dr. Murray did a transplant, and he got a Nobel Prize long years after this event. So I think it's safe to donate. This may be my last slide, yes. So I briefly talked about kidney transplant. If you don't need to be on dialysis, that's great. Prevention is always the best treatment. But if you unfortunately come to end-stage renal disease, about 0.1% general population actually end up in dialysis. But if you are on dialysis, kidney transplant, if possible, is usually a better option. And kidney transplant, there are two types of donors. You can wait for cadaver transplant 3 to 5 years, but if somebody in your family member, friend circle can donate kidney, let's explore that option because you don't have to wait and kidney tends to last longer. That's my message tonight.
Okay, thank
I'll
you,
be
Dr.
done.
Ogihara. At this time, I'd like to invite Dr. Ogihara, Dr. Wong, and also our special guest speakers, Alan, Dora, Colin, and Robin, to take the stage. And Alan and Dora are brother and sister. Alan is a kidney recipient from his sister Dora. And we also have husband and wife, Colin and Robin Kumabe. Colin received a kidney donation from his wife, Robin. And we're going to start with Alan, when they settle, Alan and Dora, who are going to be sharing their story with chronic kidney disease.
Hi, I'm Alan. It always happens every time I discuss this. Sorry. I accidentally discovered that I had a kidney disease when I was in my early 20s because I had kidney stones while I was training for the marathon. The doctor found out that the nephrologist at that time found out I had a polycystic kidney disease, and I did more and more research, and I found out I was the only one in the family that had it. I kept it as a secret, so no one knew it. Even my parents, when they would ask me how I was doing, I always say I was okay, so they wouldn't have to worry. I didn't tell anyone about my problem. I basically kept it a secret. Only my immediate family knew I had a problem. They didn't know how bad it was. My medical team knew what was going on, and they managed it really well. Normally, I would have had to go on dialysis when I was in my early 40s or late 30s, but with good management from my medical team and just following whatever they said, it wasn't until about 2 years ago when I had to make a choice. My medical team basically had me managed really well. They put me on the transplant list in San Francisco. They monitored everything on a regular basis. I was down to about 10 to 15% of kidney function. At that time, my sister offered her kidney to me. Initially, I didn't want to take it because I didn't want to risk her life or anything. But she offered it to me. We discussed it. I met with the doctors, the transplant doctors. We discussed the procedure. And I'm a paramedic with the city, so I basically know a lot of things that could happen or what could happen to both people. Based upon what they told me and their assurances about the tests, and I saw what they did, they made sure that everyone would be safe, their procedures were well proven, and everything was good. We went through the procedure. The Queen's team did an excellent job. It wasn't like a quick procedure. They wanted to make sure everyone was healthy and everyone would stay healthy. We went through a whole series of tests to make sure we were both psychologically as well as medically ready. The procedure went well. Their follow-through was incredible. I still continue to see them on a regular basis to make sure everything's okay. I see my nephrologist on a regular basis to make sure everything's okay. I follow what they tell us to do. it just works out really well. The thing about it is, as a paramedic, I used to pick up the people who were on dialysis. I've seen the people, I've seen the lives they live, I've seen what would happen to them, and I saw myself in that position. So, over the years, I kept seeing myself like that. So this transplant was a life changer for me. It totally changed my life. I could do a lot more things afterward. From pre-transplant to post-transplant, my life totally changed. I could be active again like I was before. I felt good every morning when I woke up. Before the transplant, I'd wake up, I was in pain, I didn't feel good, I didn't have the energy. Simple things would tire me out. After the transplant, I wake up every morning and it's a totally different life for me. I'm able to go back to my job. I don't work on the road anymore since I can't be exposed to the infectious diseases as much because my resistance is not as much as most people, but I can work, I can do almost everything that I did before and in a better manner. It's truly a life changer.
Hi, I'm Dora. I knew about my brother's illness when he was diagnosed in his 20s, and at that time, I knew I was going to be there for him. I didn't know how long it was going to be till he needed a kidney, but he kept everything to himself, and I would ask him, "Oh, how are you doing?" And he goes, "I'm stable, I'm fine." And so I remember the one point when he said, "Oh, my kidney's not doing so good." So I told him, "Just say the word, let me know." And he goes, "No, I don't wanna take your kidney." So I didn't press it, but I made it clear to him that I was always gonna be there for him if he needed one. And then the last time I asked him was in winter of 2013. And I said, "How are you doing?" And he says, he's probably gonna need to go on dialysis. And I said, "No." I said, "I can donate. So just let me know what I need to do." And so then I got a call from the Queen's Transplant Center, Miley, and I went through testing. And, from urine testing, blood testing, CT scan in the abdomen, checking my heart, electrocardiogram, to make sure that I was healthy enough to donate. And I was lucky that I was healthy enough to donate, which I was really happy about. So we decided to schedule the surgery, and most people will go on the internet and look up everything about kidney donation and what it's going to do, but I didn't do any research. I just figured it wasn't going to change my mind, so I trusted the Queen's Transplant Center to do their thing, and if they said I was healthy and I could do the donation, I was going to do it. So we did it in April 21st, 2014, and I'm so glad I did it because it feels so good to be able to see my brother be able to live a normal life again. And, if anybody knows a family member or a friend who needs a kidney transplant, and you would like to donate, I would seriously consider it because you can change a life for the better. And my life hasn't changed. It made me be more healthy. I drink more water now, which I never used to. But I'm healthy, and my brother's doing well, and I'm really glad.
Hi, hi. My name is Colin. My journey was a bit different. I'm a diabetic. When Robin and I had gotten married, I did one of those wellness checks, and all of a sudden I found out I had diabetes. They rushed to give me eye surgery to save my eyes. I had all kinds of complications, let's put it that way. My blood pressure was way over 200 over whatever. And so with medication and all that, I was trying to control it. But again, diabetes is one of those diseases, you can't really feel it until it takes you away. So I was seeing my nephrologist at about 22%, I think I started seeing my nephrologist. And she told me as the thing started declining that usually there's never a way in which the kidney will jump up and go back. So you have to manage it. And it's sort of like playing this game, like going to the doctor and having good numbers, but actually living a lifestyle that doesn't match it. And so you'd always hear bad news. Then one day, like Dr. Wong had said, if you don't plan for it, I was dehydrated at work. I was at 15%. My kidneys dropped. I had a renal failure. And so what happened is all of a sudden I just started convulsing. Didn't know what was happening. I was slowly passing out and just asking myself, is this it? Is this it? You know, and then I was rushed to Kaiser, which was the nearest hospital, and they told me that I had a renal failure. I was transferred to Queens, and later on my nephrologist, Dr. Stanko, told me, you know, I told you would go on dialysis, well, now is the time. So this was on February 1st, 2013, that this event happened. By March, I had I was on PD, peritoneal dialysis, which was one of the options. It's challenging to be on PD. Like any dialysis, it's actually challenging. It'll affect your lifestyle. I had problems with my catheter, so I had to do 4 manual exchanges. I don't know if you know what that means, but I would take this bag of fluid, put it up on this pole, let it drain into my body, 2 liters, and then I have to drain it out every 4 hours. And so my machine couldn't work at night. So anyway, that impacted my life a whole lot. Now I'm gonna let my wife take over because that's where the other half of the story starts.
Hi, I'm Robin Kamabe. So when Colin was in the hospital in February, I saw his nephrologist and I asked her if I could donate my kidney so that he doesn't have to go on dialysis. And she said, "Are you on any blood pressure medications?" And I said, "Yes, I'm on 3 of them actually at the time." And she said, "Oh, then you can't donate your kidney." Well, those were fighting words for me. And so I went to my doctor and I said, "I need to get down on my blood pressure medications. I'm only allowed to be on 1 medication in order to even try and go through the testing process." And so through a little work, through actually a lot of dieting, a lot of exercise, and also trying to control stress levels, that's actually the most difficult. I was finally able to get down to 1 blood pressure medication that was acceptable, and they put me through the process. By July, I think it took me about 2 months in order to get through all my tests, and those are really rigorous tests, but by July, I was ready to donate my kidney to him, and we were a match, which was a miracle too. And then we just had to wait for Colin to be healthy enough, especially from the cardiologist side. for him to be able to receive my kidney. And so then on September 23rd of 2013, we had our surgery, and I was able to donate my kidney to him. And you might want to start there.
Yeah. One of the hard parts that we had to overcome is I refused. My children wanted to donate. They wanted to donate. They were slowly eliminated. My wife wanted to donate, but I didn't want to take any donations from them because I couldn't see where I would be taking a perfectly healthy person and shortening their life. But when I had found out that there is no shortening of a life, that's when I had agreed. And so it was just a matter of me finishing through and being able to take the surgery.
I think that's, what Colin says is true. Not only was he feeling that way, that he didn't want to possibly shorten a life, but he, at a certain point, felt like it was his own fault that he had gotten down to this situation. And so why would he even deserve to have a better life? So I think, I think it's actually a lesson to us that want to donate kidneys. It's not like somebody that needs a kidney is going to go ask you for it. They're not going to do that. And we're not in a society that really makes that acceptable. Any type of inconvenience, especially if it's going to be major surgery, is not something somebody's going to ask of somebody else. So I really believe that it's actually up to people that want to donate kidneys to be the one to offer the kidney to their loved one or a friend. I mean, we've had people up here that have just altruistically donated to anybody, but I don't know. That's something that I just feel very strongly about. My experience, just like Dora's, it was an awesome experience to be able to give a life, especially for my husband, to be able to have a quality of life afterwards that is, incomparable in comparison to being on dialysis. And for me, the surgery, Dr. Ogihara was awesome, really good bedside manner. I wasn't scared until I actually saw the lights in the operating room, and then Dr. Ogihara introduced me to the whole team that was going to give me surgery, and then the anesthesiologist put the mask over me, and that was it until I woke up. And, both of us actually got out of the hospital a lot earlier than we thought, but this whole process for me actually made me healthier too, just like Dora. I was, at the end of the surgery, Dr. Ogihara took me off of that last blood pressure medication, and so we both were healed in the process. That's kind of the story for us.
Thank you so much for sharing your stories. At this time, we're going to open the floor up to questions. So if you have a question for the doctors or for the guests, please raise your hand, and we have microphones, and we'll come down so everyone can hear your question.
Question to Alan and Colin. Now that you have 3 kidneys, is the new kidney doing all the work for all 3?
In my case with polycystic kidneys, they had to take out the 2 kidneys. Normally your kidney is about, like Dr. Wong said, is the size of your fist. But because of my disease, my kidneys had grown extremely large. My kidneys were 20 pounds each.
Wow.
So I lost 40 pounds after the surgery. The surgeon said he had a difficult time removing them, and because no one knew about my disease, people thought I was just living the high life because my belly was getting big, and they thought I was just drinking a lot of beer and just eating a lot, when in actuality it was just my kidneys getting that big. So it was not a standard surgery in which the surgeons normally do. My surgery was 6 hours. They took out the first 2 kidneys, then they replaced the other one. So I only have 1 kidney in me.
Yeah, for me, I have 3, which what I was told was the remaining 2 kidneys will more or less shrink and then her kidney will take over. So my GFR at this point from my last doctors is 52%. So it's over half. Yeah. Okay.
I have a question about toxicity to the kidneys of Tylenol, if there's any effect.
The toxicity of Tylenol is most well known for livers, but over time, the cumulative total amount that you take of Tylenol can add up and can become toxic. So you would need to do the math as to how many per day for how many years, but it can become toxic to the kidney, yes. The occasional Tylenol for headache here and there, no big deal. But if you're taking it daily, several times a day for years on end, it can become toxic to the kidney as well.
The two doctors, but the other panel members are free to put in their own opinion. Basically, your kidney is a filter, and one of the best things for flushing it out is water. So, we're encouraged, as people with kidney problems, encouraged to drink a lot of water. But unfortunately, not all water is the same. You got bottled water, you got Flint, Michigan water, and it depends, even in Hawaii, we're very fortunate that we most of the times had only chlorine in a drinking water, except for the military base. So my question is, what are your opinions about drinking distilled water? Because from my reading and different books, some people say it's great, you should only drink distilled water. Unfortunately, on the other side, it doesn't have any minerals and vitamins, so you have to make that up with your diet. And some people say that it might cause osteoporosis, but on the other hand, the comments are like, it removes only the inorganic contaminants from your kidneys, but the rest of the organic stuff stays intact. So I experienced myself personally drinking distilled water, and I had a cyst that went down from 2.9 centimeters down to 1 in a period of few months. But I don't know if it's from the distilled water, but I've been monitoring all my parameters pretty good because I'm an engineer, so I'm, very crazy about data and stuff like that. So what is your opinion about using distilled water to help kidneys, even people with transplant?
I don't have enough data to suggest distilled water over tap water. I know I was a director for dialysis units on Oahu, and the quality of our water is quite good. Yes, there are minerals and some salts in the water that we drink, but it's nowhere to the magnitude that we know of, and you may be ahead of your time, but to date, we have a lot of other things that we don't take care of that account for kidneys getting worse, much more than the quality of the water that we have in Hawaii. I mean, I can testify from various areas of testing that the quality of water from the tap is actually pretty good and very good in Hawaii. So I don't have a strong opinion about distilled water, but if there's any other, I may be ignorant.
No?
Okay, we have another question here.
Thank you for a very interesting lecture. The doctors, I'd like to ask about one word that you brought up earlier, the word toxin, and concentrate on that. And what is your opinion, essentially, of all of these? There's a multi-billion-dollar industry in selling supplements and antitoxins and all of these crazy things well, how good are they, and are people wasting their money, or do you recommend some? Just your comments on that one word.
So kidney toxins come in many forms, but a lot of them are concentrates out of nature, or they could be pharmaceutical derivatives. So I think, generally speaking, the more you can feed yourself directly from nature, the less likely you're going to have exposure to toxins. Now, that's not necessarily true, but for example, there has been things like aluminum toxicity in the water supply. So you do have to watch what comes into your body. But I don't believe in, and this is a personal opinion, so take all the MD away, okay? So it's not a doctor saying this. It's just my personal opinion that if we focus more on the quality of what we put into our bodies, the food, the drink, the thoughts, the feelings, everything that we put into our bodies, then we'll have less need for medications. I don't think you can supplement good quality food, drink, thoughts, feelings with supplementing with antioxidants or minerals or, so I think they may help, but I don't know that, haven't seen enough data to prove that they help. So I do believe that there's a multi-billion-dollar industry because of the possibility, and yet we don't take care of what we know already makes a difference. So I would rather us focus on the quality of food, drink, our, stressors, if you want to call them that, the quality of our lives, our thoughts, maybe the media, I don't know, whatever you put into your body is going to take a toll somehow if you're going to feed it things that are not healthful for your body. So I'm not a big believer in supplements, but for those who have a poor diet, it may help them a little bit. But I think improving the diet might be the better way to go.
Okay, I think we have a question down there.
Good evening. The question is diagnosis for CKD. I wasn't given a urine test to see if there's protein. Can the GFR be determined from a comprehensive blood analysis?
Yes, so the GFR is calculated anytime a blood creatinine is measured, and the blood creatinine is included in basic as well as comprehensive metabolic profiles. So it's one of the most common tests or profiles ordered. In addition to the GFR, though, it is useful to get the urine protein or urine albumin measured if you have a risk factor. If you don't have any risk factors for chronic kidney disease, it's not advisable to measure urine albumin or protein. But if there are any risk factors, then it is recommended to check that yearly.
Hi. I'm really grateful for hearing of the courageousness that is being represented tonight, so thank you for that. And my question is about diets. How does diet change after transplant?
The transplant team does a really good job in trying to remind you to make sure you eat better, eat healthier, drink lots of fluids. One of the things that I do is I have bottles of water in my car, I have bottles of water at my desk. So when I'm at home, I have pitchers of filtered water in my refrigerator. So I drink a lot of water. I try not to drink any other things unless it's under special occasions. I don't drink alcohol, so it's usually the only thing I'll drink is either juices or maybe a soda once a day. In terms of food and all that, you tend to realize the gift that you've been given. You don't want to waste that gift. You try to make sure that that gift lasts forever and it's not a fruitless effort. So you always have that in the back of your mind, so you tend to eat healthier. And I found that I tend to eat healthier. I eat very little red meat. Most of the time it's usually just vegetables and chicken and things like that. But it's a thought that you've been given a gift, and you don't want to waste it. So you take care of that gift. And the transplant team does a really good job of educating you before and after the transplant and following up to make sure that you understand what you have to do. I've heard of people who have gotten transplants and they didn't change their lives. They didn't follow what they were supposed to do, and the kidney fails. And that's such a sad thing because someone has given you a kidney and given you a second chance at life. And you realize how important it is to make sure you stay healthy and make sure you follow the guidelines that they ask you to. It's not very hard. It's not very hard. It's not like you have to stick to a strict diet, but it's natural things like don't drink to abuse, don't eat to abuse, do everything in moderation, and it works out really well.
I think for myself, definitely there have been changes. One of the things that I found very helpful, like I take my blood pressure a minimum of 2 times a day, usually about 4. I also track my blood sugars. I'm a diabetic, and I also shoot insulin. I also keep a watch of my records from all my doctors. They're all from DLS. And so I can go online now and I track. So at any point in time, I know what the doctor's looking at and I ask questions. And what do I need to change? What do you think? And I've also switched to more plant-based, which I think is kind of important. I've done research myself on a plant-based diet. Not that I'm advocating for it. I'm still trying. But, the amount of meats. Yeah, we increase our vegetables, hardly any processed starches. That really helps. And so my numbers are really good. So that really does change when you've given, like Alan said, a gift. And, it's her. So, it'd be an insult to not take care of it.
Okay, thank you. We have a question up there. Hi, I was here a year ago, so it's really nice to see all of you again. And I want to say kudos to Miley. After the presentation a year ago, I signed up to be a donor, but then my husband got selfish and wanted me for himself, so I had to stop the donor testing and all that. But I want to say thank you to Miley for her professionalism and her caring and her understanding.
Hi, I just wanted to ask, is there any foods that you can't eat that you could eat before the transplant?
Go ahead.
They ask that you not eat things that will give you the possibility, because you're immunocompromised to a bit, they don't want you to be introduced to some sort of anything that can carry high levels of maybe hepatitis or any kind of high levels of bacteria. The biggest thing that I can't eat is poke. I can't eat raw fish or sashimi anymore, so that kills me. I smell it, I'm like, oh my God, I used to love the poke and the sashimi and the raw oysters, but you know what? It's a small thing to give up. It's really a small thing. You just make sure your hamburgers are well done. You make sure your meats are well cooked. The chickens are well cooked. All the meats that anytime you eat, you just make sure it's well cooked. But that's the only thing I just can't eat. I just can't eat any raw fish or anything raw.
Yeah, sashimi, medium rare prime rib, medium rare steaks. You have to make that change. I mean, you don't want to get sick. So, and like he said, you have a foreign object in your body, actually, and especially for my wife, she's actually a stranger to me in the genetic world. So what happens is they give you basically 3 drugs that you have to take regimentally all the time. And it suppresses your immune system so it doesn't attack the organ. And so we want to follow all the rules. That's really key. So I take that drug like clockwork. So Yeah. Everything else is okay, I mean, pretty much.
There's some really good French cheeses that have live bacteria in it too. They have to be careful about those kinds of things. So some of those really expensive cheeses.
This is for the doctors. Is there a ballpark age cutoff for donors?
So the question is that the donor age cutoff. We don't. If you go to national data, I think about 7,000 to 8,000 donors donate in this country every year. There are donors above 70. It's only about 2%, 1 or 2% of the donor population. So some centers are accepting donors from 70s. My personal experience, the oldest donor I've done surgery on was 65. Was successful, her husband to wife. It's not a biologic, I think, not a biologic, chronological age itself. But if you are 70s, we pay attention to everything, and chances are you're not gonna be recommended. We can find something to discourage you from donating. But if you can run full marathon and do the yard work and taking no medication, then you could still qualify, yes.
Okay, we have time for one last question. Go ahead, sir.
Yeah, just a quick question. I am on dialysis, yeah. And this is for the doc, I guess. They said that I'm at risk, my vascular system is at risk of stroke and I guess heart disease. And I just wanted to know why.
That's a good question. But so recognize that the filters in your kidney are tiny little blood vessels, so they're part of the vascular system. And so something has damaged those finest little filters or smallest little arteries over time to the point where the kidneys don't work. So it's just an indication that there's damage being done. But there are oftentimes many traditional risk factors for blood vessel circulation problems elsewhere. Diabetes, high blood pressure, cholesterol, smoking, all those things are risk factors for clogging of the blood vessels anywhere. And we don't know why they clog one place or another. But in addition to that, we worry about things accelerating cardiovascular disease in kidney dialysis patients. Sometimes calcium and phosphorus is a suspect. Too much phosphorus in the body. Also, inflammation in the body may accelerate narrowing of the blood vessels or stiffening of the blood vessels. And the dialysis procedure itself is a little challenging, right? Hemodialysis, so blood dialysis, when they're taking blood out of your body, and now your blood pressure might actually drop while they're taking out the salt and water from your blood, circulating blood. So we have to do that very gently so that your blood pressure doesn't drop too low. If it drops too low to a clogged blood vessel in your heart or your brain, then you could have a heart attack or a stroke type of thing. So it can hasten or accelerate you having an event if we don't do dialysis very gently, and if you're not paying close attention to what you're putting in your body. You don't want to put in too much salt and water, so they don't have to try to take out too much salt and water. So there's a lot of things going on there, but you're right. The risk for a cardiovascular event is higher in those who have kidney disease and on those on dialysis as well. But I don't say that to scare anybody. It's really I think as soon as you start to feel a little scared about anything, I think it's always good to look at, well, what am I grateful for exactly as I am? And there's always so much to be grateful for exactly as you are. You know, the fact that you could ask me that question, the fact that you're here. I mean, we have so many miracles every single day in life. And so looking at what can I be grateful for? What do I want to do? What am I willing to do to buy more time and to get out of life what I want? And I think we can all, no matter where we are on the scope of, birth to the last transition, we can get a lot out of every day if we are grateful for it.